Welcome to Let's Talk PCOS. I'm Christine, and if you've ever felt confused, dismissed, or overwhelmed on your PCOS journey, you're in the right place. This is where we connect the dots between hormones, inflammation, and real-life support so you can understand your body instead of fighting against it. You don't have to figure this out alone. Let's talk PCOS.
Welcome. I'm Christine, your PCOS coach and dental hygienist. And today we are talking about something that causes more confusion than almost anything in the PCOS space. We're talking about the difference between PCO and PCOS. And I want to start by asking you something. When you were told you had PCOS, or when you first suspected it, was it because of an ultrasound? Did somebody look at your ovaries on a screen and mention cysts or follicles and then use the word PCOS? If that is your story, this episode is specifically for you. Because here is what most women are never told. Having polycystic ovaries on an ultrasound and having polycystic ovarian syndrome are two completely different things. PCO, polycystic ovarian morphology, is a structural finding. It is a description of what the ovaries look like on imaging. Specifically, it means there are 20 or more follicles visible per ovary, or the ovarian volume is above a certain threshold. That is it. It is an image finding the same way a freckle is a skin finding. It tells you something is visible. It does not tell you what that means for your health. And here is the part that stops women in their tracks. When I tell them up to 1 in 4 women have polycystic ovaries on ultrasound. Many of them have completely regular cycles, normal hormone levels, and 0 symptoms. They go through their entire lives never knowing it was there because it never needed to matter. PCO does not cause PCOS, and PCOS does not require polycystic ovaries to be diagnosed. Let's say that again. PCOS does not require polycystic ovaries to be diagnosed. You can have PCOS with normal looking ovaries, and you can have polycystic ovaries without having PCOS at all. So, what actually makes it PCOS? As we talked about in the last episode, 2 out of 3 criteria: irregular ovulation, elevated androgens, ovarian morphology on imaging, or a high AMH, which means the ultrasound is just one of the pieces of the picture. One piece alone does not make a diagnosis. Now, why does this matter practically? Because I have sat with women who spent years managing anxiety, making fertility decisions, and structuring their entire health approach around a diagnosis they may not actually have. Because nobody explained the difference between the image finding and the syndrome. I've also sat with women who were dismissed, told that their ovaries looked fine, so it cannot be PCOS, even though they had irregular cycles, elevated androgens, and every other symptom in the book. They have PCOS. The ultrasound just didn't show it. Both situations can cause real harm, and both happen because of incomplete information. If you were diagnosed based solely on ultrasound alone, that conversation with your provider is worth revisiting. Ask about hormone levels, ask about cycle history in detail, ask whether you meet the full diagnostic criteria because you deserve a complete picture, not just a partial one. And if you've been dismissed because your imaging looked normal, but your symptoms tell a different story, keep advocating. You know your body. The image is one data point, not the whole story.
Thanks for being here. Don't forget to like, comment, and share. Real talk, real women, real life. See you next time on Let's Talk PCOS.